This is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Just about 20 minutes after 10 o'clock. Beautiful, what is it, Wednesday, Robin? You made it to the middle of the week.
Yes, we did.
Can you believe it's the 5th day of December?
I know, 20 days till Christmas. And it's the middle of Hanukkah. What could be better?
We want to talk to a couple of people right now about over-the-counter medicines, right?
Yeah.
Dr. Veronica Vernon is on the phone. She's a doctor of pharmacy and an internal medicine resident at the VA. And Anita Brinkman is on. She's the executive director of KnowYourOTCs.org. OTC stands for over the counter. Ready?
Yep.
This is a foundation focused on medicine safety. So it's an important topic, especially when you are able to, or at least you think you're able to, diagnose yourself on the computer, right? You go to WebMD or Google, whatever, and you think you figured it out, and then you get over the counter, and it turns out you might have messed up. So let's find out how to do this stuff safely. Dr. Vernon and Anita Brinkman, good morning, ladies.
Good morning.
Are you both in the same place?
Unfortunately, no. Yeah, go ahead, Dr. Vernon. I'm actually in Indianapolis.
Oh, okay.
And I'm in New York City.
Oh, okay. Well, thank you, ladies, for being on this. We got a big triangle, Robin, from Indiana to Florida to New York right now,
wonderful.
Right? So, but you're both
there you go.
You're both in cold places, and we're in the warm. We're the odd man out in this case.
Yes, I wish I were where you are.
So let me ask you, I'll start with something really kind of the obvious one, is when we live in a world of information, we can look up things on things like WebMD or just Google to say, what's wrong with me? I got this itch or I got this stomach ache. And then we go over the counter. That seems like it's asking for trouble. Am I right?
Yes, there's a lot of information on the internet. Not all of it is correct. There's actually a wonderful resource where you can look up information on over-the-counter medications to treat cough and cold symptoms. And it's called KnowYourOTCs.org.
Okay, excellent. And that's why we're talking today, so that we can steer people away from the less reliable websites, correct?
That's correct. And always ask your healthcare provider, ask your pharmacist, ask your physician assistant, your nurse practitioner if you have any questions at all.
And so are the over-the-counters, how do I ask this question? This is maybe for Dr. Vernon. When we go to the pharmacist and ask for something, is that already over-the-counter? In other words, without a prescription?
If you're looking for the products that are out in the aisles that aren't behind the pharmacy counter, those are going to be considered over-the-counter. And so those have gone through testing, and they've been approved by the Food and Drug Administration to be placed over-the-counter if they're an over-the-counter medication. We also have herbal supplements over-the-counter, which don't have to go through the rigorous testing process like the actual medications do. And
are they, and talk about them for a second if you could, are they... like if I went to KnowYourOTC.org, could I look up to say, if it was prescribed, it looks like I would need this, but I don't want a prescription. Can I use this herbal alternative?
So KnowYourOTCs.org is going to go over the over-the-counter medications and give you the recommended dosing that's recommended for over-the-counter and what's been shown to be safe and effective. Herbal medications haven't been shown to be have any effectiveness data. They don't have to support that they're really effective at treating what they claim to do. So I always recommend that you're checking KnowYourOTCs.org for the most up-to-date information and talking to your healthcare provider. Talk to your pharmacist. We want to help. We're right there standing to help at the pharmacy counter.
And when it comes to KnowYourOTCs.org, we also do have information about the different vitamins, whether it's a multivitamin, different vitamins you might take as part of your self-care regimen. There is information on that, but as Dr. Vernon said, it's always good. Whenever you go see your doctor, talk about what you're taking over the counter or when it comes to your vitamins, because that person who knows your whole medical history can be on the lookout for any interactions between, let's say, a prescription drug and a supplement. So when you go to the doctor, don't just talk about what prescription drugs you're taking, but also what over-the-counter medicines or any vitamins, dietary supplements you're taking. That way, your healthcare provider gets the whole picture of what you're taking and can advise you the best way.
So I want to share with you a personal story. A couple of years ago, I had some vein work done in my legs, and I was very happy with the results. But the doctor who was seeing me gave me a prescription, and she also recommended that I take some supplement. And she said, this is good for your veins. It started with an L. I think it was L dash something. And that right there, what I just described, is my problem. I forget what it was called. And I always thought I should probably continue taking this even after everything is back to normal, which it is. So right there, I didn't even remember. Could I go to this site and maybe pick your brain a little bit and say, I had a supplement a few years ago and I can't remember what it was?
We have very, I would say, basic information about the different dietary supplements that are available, but something that is very specific and has been prescribed previously by a healthcare practitioner, I would try to go back and get some personalized advice, either from that healthcare practitioner or your pharmacist, because there are a lot of nuances out there, and very specific supplements have different uses. Dr. Vernon, maybe you could weigh in here as well, but something that's that specific, we do have information about dietary supplements and vitamins on knowyourotcs.org, but if you're looking for something that's very specific to you, I would bring in a healthcare provider for advice.
I gotcha.
I completely agree. You need to talk to your doctor, your nurse practitioner, your physician assistant, and talk to your pharmacist as well.
So here's a question that often comes up. Let's say the woman in a couple is 100 pounds and the guy is 300 pounds. The dosage on the label doesn't differentiate between somebody who's 3 times bigger than somebody else. Does the website help with that? Does the recommended dosage not change? Who wants to answer that?
Usually for most over-the-counter medications, there is no change based off of weight. For pediatric medications, we can make adjustments in the dose based off of the child's weight. That's why I say for parents, it's always important to know how much your child weighs when you're talking to your pediatrician as well as your pharmacist and trying to make a dosage recommendation. Most medications over the counter,
okay,
we'll exclude prescription medications, can be used in patients regardless of their weight. It's just really important when we're talking about children because babies and toddlers and younger children have all different ways of processing the medications in their bodies. So we use very, very tiny doses for babies, and then we can increase the dose as the child gets older.
And then there are medications.
Dr. Vernon.
Go
ahead. Sorry.
There are medications that I've noticed adults have been taking, like Aleve or something like that, Advils. And then when I was reading the label the other day, it said it should not be taken by somebody over 60. Is that right?
That can be correct.
Contraindications, yes, definitely. There are contraindications to certain types of medications, and that's why the drug facts label is so important, because those warnings are there, right, Dr. Vernon?
Yes, they are. You want to read that drug facts label in its entirety before you take a medication.
So right now I guess we're in the flu season. I don't really know that. Knock on granite. I said the granite. I don't have any symptoms, but usually at this time of year, well, I'm always last. I think I was first one year, right, here at the office.
Yeah, you were.
So is there anything to take that would prevent the flu or the cold other than the vaccine?
You definitely want to get your vaccine. Yeah, you can take that one, Anita.
Okay, yeah, definitely the vaccine is the best bet, and it's not too late to get it. What we're hearing from the Centers for Disease Control is that this year, flu season is expected to peak in January and February, so you still have time to get your flu shot. But your best bet, whether you're an adult or a child, is getting plenty of rest and then hand washing. That sounds so simple, but really taking the time to wash your hands before you eat, after you go to the bathroom, if you've been in a public place, and really wash your hands, like for 20 seconds with warm, soapy water to get rid of those germs. Cold and flu viruses can live for quite some time on surfaces, and during this time of year, they're everywhere.
Oh my
so
gosh.
really practicing some of that hygiene hygiene is like, especially if you're the first one to bring it in the office, there's those different disinfectant wipes. Wipe down your computer keyboard, doorknobs, all kinds of things like that, because that's how you can pick up the virus. But if you are well hydrated, healthy, and you're practicing good hygiene, and you've gotten a flu shot, that's your best arsenal to keep healthy through cold and flu season.
And pregnant women can be safe taking the flu shot also?
Yes, definitely. Pregnant women should be getting the flu shot. They are at a much higher risk of getting the flu than an individual who's not pregnant.
All right, before we say goodbye, do you have a website that gives us all the information we need?
Yes, it's the one we've been talking about. It's knowyourotcs.org, and that's spelled KNOWYOUROTCS.org. We've got information about a lot of the medications that we've talked about, how to use them safely, how to store them safely, and also how to dispose of them once they're expired. So that's knowyourotcs.org. We invite people to check it out.
Dr. Veronica Vernon and Anita Brinkman, thank you, ladies. Have a great holiday season.
You too.
Thank you, you too.
All right, we'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Here is your 1-minute news brief. Governor Scott will not become Senator Scott until January 8th. That's the day his successor, Ron DeSantis, is sworn in to be governor of Florida. The family of a 36-year-old Tampa woman who disappeared in Costa Rica says a body found on Monday is hers. Investigators say a newly released photo could help identify the victim of a 45-year-old murder mystery in Seminole County. Her body was discovered badly decomposed near the northeast part of Lake Lotus in Altamont Springs 45 years ago. Authorities say a Panhandle father was justified under the state's Stand Your Ground law when he fatally shot and killed his 32-year-old son. A team from the University of Central Florida has won a national cybersecurity competition. A Florida Highway Patrol trooper who was hit by a car while pushing another man out of